Hello, my name is Dr. Greg Symko, and I'm a chiropractor, but I'm a chiropractor with a difference. I'm what you call a functional healthcare provider. Now, what does that mean? Well, when you go to a chiropractor, or myself, whatever, you go with possibly a low back pain, your back hurts, or your neck hurts, or you have headaches perhaps, or your upper back hurts, or whatever. And the chiropractor looks at you and says, let's examine you and find out what's wrong. And they say, well, you know what I found on you particularly is that there's a spot in your back made up of vertebrae, and one of the vertebrae are out of place. So I have to adjust it, I have to treat it. So you may get some physical therapy like electrical stimulation or moist heat or ultrasound, massaging, or whatever. And then you get an adjustment where you actually try and put that vertebra back to where it was supposed to be. And you feel pretty good. And most of the time, you do very well with that. And people get better rather quickly and don't need too much more therapy after that. But a lot of people, or some people, find themselves saying, geez, my back hurts again. And I have to go back to the chiropractor. And it gets worked on and it feels better. And they go home and they go about their lives and they feel good for a while, and then all of a sudden they're going back again. And you find yourself after about a year or two that you've been to the chiropractor several dozen times, and you still kind of have this nagging back pain. It's not 100% gone. It feels okay than it did, but it's still bothering me. Now, there is an answer to that, and this is what a functional healthcare provider, a functional chiropractor, does, and does very effectively. Now, let me explain with a chart here. I'm going to show you a chart with a brain attached to a spine. Now, not the whole thing, but let's say we all have a brain like this, right? We all have a brain, and we all have a spine, okay? Now, let's say this part of your spine right here is a problem, and it's getting treated, and you're feeling okay, and then it comes back, and you go back again. Now, what a chiropractor would tell you, and actually science tells you, is that the brain, right up here, runs all these organs. Runs your heart, runs your lungs, runs your liver, your stomach, everything. And it runs it through nerves that come from your brain down your spine and shoots off this way. And what you're told is that if there's an interference here, there could be a problem here, or whatever. But what is missing with that explanation is that the brain also runs the spine, okay? So if there's a problem here and you're getting treated and it comes back and you get treated and it comes back and you get treated, well, the problem may not be there, but maybe here in your brain. There's very specific parts of your brain that we know as scientists, neuroscientists, and functional health caregivers that runs the muscles in your spine. Now, can you imagine if certain muscles in your spine are not working then? Well, these are not moving very well. And when you bend and turn and stuff, they're not going to bend and turn the way they're supposed to, and they might actually hurt. So if that's not working, this is probably not working. So this needs to be addressed. So anyone that takes care of this needs to take care of that. Now, here's the other amazing thing or interesting thing about functional healthcare is that we try and find out why that's not working. Now that is interesting. Now in my office, we treat people with functional healthcare. Functional healthcare basically is the approach where everything affects everything, and you have to look at everything. So when healthcare providers, medical doctors, chiropractors, physical therapists, what have you, study in school, and myself did the same thing. We study the body, the human body, by chapters. So we look at a chapter on the heart, a chapter on the spine, a chapter on the head, a chapter on the eyes, a chapter on the nose, a chapter on the mouth, all that kind of stuff. And you have specialists. You go to a heart specialist, cardiologist, or a vascular specialist. And so they look at these things as this is my specialty and this is what I'm going to take care of. That's fine and dandy, but what a functional doctor does is he or she looks at the totality, everything that is involved in the human condition. So what I like to tell patients, and what I do, is that I treat patients as a book, a whole book, and not a chapter. And that is, in a nutshell, functional healthcare.